Hello everybody, welcome back to another AHN Prehospital Care Assessments. Today we're in Wexford at a beautiful morning. I have the CEO of AHN Wexford, Dr. Allan Klapper, here with me today, and Manager of Prehospital Operations, Mr. Wesley Simple. So Dr. Klapper, why don't you tell us a little bit about the exciting news here at Wexford?
We're so excited about Wexford Hospital. The mission of Wexford Hospital has been to provide the highest quality care close to home. We worked very hard over the past 4 years in designing the hospital and making sure that we provide the right services and the right care close to home, so our communities, our patients don't have to leave the community to go to Pittsburgh for some of the most advanced care and from leading physicians in the marketplace. What's unique about Wexford, which is really interesting, is that the planning for the hospital, from design to services to operations, started with our clinicians, our doctors, and our nurses, making sure that that design provided not only the services, but provided those services in a way that improved quality and improved outcomes. This hospital is going to provide a range of services. We have a 24-bed ER that has the capability to treat pediatric patients along with behavioral health patients. We have an ICU, a variable acuity ICU that focuses on patient experience in the ICU and optimizes that experience. We have a women's and infant center where we can care for babies 32 to 34 weeks and above. We'll be able to provide some of the most advanced surgeries and medical subspecialties so that patients get care here close to home. They can stay here, and with some of the advanced technologies and surgeries, they can get back to work or back to their normal routine activities the same day or very shortly thereafter.
Yeah. I know everybody in the EMS community is very excited about all the services that will be offered here, without having to drive down to Pittsburgh. So that's great.
It should be a fantastic addition to the community, not just Wexford, but we've planned this so that our communities, all the communities north of Pittsburgh, Allegheny County, Butler County, Beaver County, all of the patients north of Pittsburgh have access to some of the most advanced care and some of the most advanced physicians with advanced training as possible.
So Dr. Klapper, when is AHN Wexford slated to open?
We're targeting early fall for opening. We have a number of steps that we have to go through. We're almost there. We want to make sure that before we open, everybody's been trained. We've simulated normal hospital operations. We're confident that when we open those doors, everybody's getting the best care possible.
I hear you have some exciting news for the northern community.
We have an announcement that's been for more than a year in the process and planning. As part of providing expertise and care in the community and keeping care in the community, we've been planning on a community response unit. It's a paramedic unit to support EMS in the local community, and it's part of a lot of the other units that we've set up throughout Western Pennsylvania in partnership with our other hospitals.
And that unit is managed by Mr. Wesley Simple here. You want to tell us a little bit about the response units?
Absolutely, Matt. Thanks for having us. And Dr. Klapper, we're super, super excited to open up the new response unit here at Wexford. So we've had paramedic response units throughout Western Pennsylvania dating as far back as 1988. So AK Pulsar at Allegheny Valley Hospital was the first and kind of set the bar for that. We operate 2 units in that region, along with 2 in the southern region in Belle Vernon and North Huntington, along with another one at Forbes. So we have 5 and soon to be 6 at Wexford. So we're really excited to bring the advanced level care and seasoned providers and specialty equipment and everything that we can offer everywhere else here in the Wexford community. The biggest thing that we look at as a huge bonus for us, as Dr. Klapper alluded to, the location for this. With Allegheny County, Butler County, and Beaver County, this is a great geographic location to have that, and our footprint to help our EMS partners, and more importantly, the community and the residents that they are serviced by this hospital will be huge.
For those a little maybe unfamiliar with the response unit and some other geographical areas, how would you kind of describe that?
So the paramedic response unit is a sole paramedic operating in an ALS licensed squad that brings advanced level care Lucas devices, all the normal ALS equipment that an ambulance would carry to assist the EMS services, whether it's a critical call that they need an extra set of hands, they're coming from a distance and they need somebody else to assist or quick response to call for them. Another bonus to this is having that community feel. So community events, community days, touch trucks, different specialty events, and even special sporting events that we might be able to assist with would be something to really help those EMS agencies.
When are you slating to open that too?
In conjunction with the opening of the hospital, we're planning to open shortly thereafter, right around the same time that the hospital itself opens.
All right. Well, I know that both of you guys worked very hard to get that response unit up and running here in September, so I thank you both, and everyone in the EMS community is very excited about it, and I'm excited for it to happen. So, thank you guys for both being here today.
Thank you. Thank you, Matt.
We'll catch you guys next time on the next AHN Prehospital Care Assessments. Thank you.